My name is Grumley. I'm a speech-language pathologist at Penn Highlands Elk. In order to become a speech pathologist, I had to attend school. I got a 4-year degree at Ithaca College in New York, and then I actually got my master's degree at Pitt. So in order to be a speech pathologist, you have to get a master's degree. So it took me 6 years to become a speech pathologist. And then my first job out of school, I actually worked at a school in Pittsburgh. It was a charter school, and then I became a traveling therapist. I traveled all around the state and just worked at different nursing homes. So I had a lot of different experiences leading up until this job. My main responsibilities include the evaluation and treatment of communication disorders and swallowing disorders. So I can work with a variety of patients. At Penn Highlands Elk, I have the opportunity to work with all ages, but as a speech-language pathologist, normally we can either work in schools with children, in hospitals with adults, or in nursing homes with adults, or in rehab clinics, like the outpatient clinic that I get to work in here as well. So I can work anywhere from teaching a child how to produce their R's or their S's, all the way to providing a communication device for an adult that has lost their ability to communicate. So the variety in this field is really great. The biggest skill that is required for my job is people skills. You have to be able to work with all ages of people and also be able to gain rapport with a lot of different personalities. It can be difficult at times, but it's also very rewarding when you can establish those relationships. But that is probably the biggest skill. My average day is coming to work. I get my schedule for the day. I have a schedule of patients that need to be seen. There are 2 other speech pathologists that work here, so between the 3 of us, we split up the patient caseload between our outpatients, the inpatients at the hospital, and also we see patients at Pinecrest. The 3 of us get to cover all of those patients that need seen. So after I work with a patient and do a therapy session, I also have to do a note and have to write up what I did with that patient and their progress. And then depending on whether it's a new patient or a patient that we've worked with, we also do evaluation. So I have to do a whole entire evaluation report on certain patients that are new patients. And paperwork can be a little daunting at times, but that's part of the job as well. So probably the biggest challenge that I face is just motivating people at times. Sometimes really young children can be difficult to motivate or even to gain their attention and focus. Older adults too, people that live at Pinecrest or the elderly, sometimes they don't have a lot of motivation to participate in therapy. So really having that ability to motivate all ages is probably one of the biggest challenges. Another challenge that we also face in this field is changing diets for people when you work with a patient that has swallowing disorders, and having to recommend a diet change where they may have been eating normal foods their whole life and now you're recommending a pureed diet. That can be hard. Patients don't always want to have a pureed diet or thickened liquids, so it's really hard to make those recommendations, but you're doing the best thing if you're protecting them from developing pneumonia or getting really sick. So that's probably one of the hardest things too, is to work with family and make those recommendations. So what I enjoy most is the relationships that I make with my patients. I have some patients that I have worked with for years, and they really feel like they become family. And seeing the progress that they make and helping somebody to be able to communicate or eat again. If it's a person that has a feeding tube and they weren't able to eat, and you are able to teach them how to eat again, it's really rewarding seeing the outcomes and the progress that patients make. The reason that I decided to move back home after living in Pittsburgh and living in Altoona and different cities was that my family is here. So it was really important to me to live somewhere where my family is. And I also like that it's a small community, and I feel like the people that I work with have also become family. There isn't a lot of turnover in the rehab department, so the people that I've been here for 6 years, and the people that I have worked with have been the same people. So I feel like I've really grown with my coworkers, and I feel like we have each other's back, and it is a really tight-knit group that I work with. So it's really special to be able to work in an area that you feel confident in the people that surround you. And also living in Pittsburgh and working in a bigger hospital and learning the skills that they teach in those hospitals, and to be able to come back and provide that same level of care in a smaller hospital, it's really rewarding to me to be able to give back to the community that I grew up in.